Good evening, everyone. I would like to welcome each and every one of you for Mental Health Webinar Series 2020-2025. Today, we are on session 1776 on topic Impact of Stress on Heart Health with our Honorable Resource Person, Ms. Kushum Tiwari, ma'am. I would like to welcome you, ma'am. Then, I would like to welcome all other organizers, participants, and coordinating team members on behalf of the American College Madurai in association with Global Counseling Center Chennai, Tech and Positive Mental Health Practitioner Association, Telangana. A short intro about today's resource person, Kusum ma'am. She is a holistic healer, dynamic meditation healer, spiritual mentor, motivator, and transformer of life. With that short intro, I would like to hand over the session to you, ma'am. Happy to have you, ma'am. The floor is yours.
Thank you, sir, and thank you, everybody. Good evening to one and all. Om Shanti too. So, my topic is impact of stress on heart health, and we should understand difference between stress. So, I will introduce you. See, as I have given in intro in my PPT, stress is a natural response to challenges. So, I would like to say that challenges will be there always in our life. So, stress is a natural and normal response to challenges, changes, or threats that is given. And it's a psychological response that prepares our body to either fight or flee from the dangers, you can say. Sometimes what we are thinking and what is happening in the life, it is very different. No? So we feel sometimes dangerous situation also. We are not understanding what to do and what not to do. And then we are stressed out. So stress can be acute or chronic. And while some stress can be motivating and help us to perform better, so we have to see this. Now, I will let you know that some common stress that we all face, work related stress, no? Long hours we are taking heavy loads, no? Job insecurities or conflict with colleagues also. Sometimes we feel stress. These are the sources, common sources I'm talking about. And sometimes financial stress comes, debt, financial insecurity, or unexpected expenses. Now, third type of stress is what? Relationship stress, conflict with family members, friends, or romantic partner, whom so. Now, health-related stress is also there, chronic illness, pain, or disabilities. Now, major life challenges also, like moving or switching job, na? Divorce, death of a loved one. Now, some physical syndrome of stress are जैसे headache, फिर digestive problem, muscle tension, rapid heartbeat, sweating, these all. Emotional stress, we feel anxiety, now irritation, mood swing, restlessness, feeling overwhelmed, lack of motivation, difficulties, how to express ourselves. So these all stress. In my PPT, I have talked about chronic stress, and it can give us serious health issues also. And primary areas, one of the primary areas affected in heart health. So I will explain each and every topic that I have given. I have given three here. So three in intro, and I will explain, and I will tell you and let you know that what precautions we should take and what cares also. So you can write also if you like to write. Now, emotional stress, I have talked ki anxiety, irritation, and all. Now, managing stress is also there. So, how to get rid of this if we are facing all this type of a stress? I told you stress of work related, finance related, relationship, health related, and I talked about the symptoms also. So, how to overcome, how to manage this? For this, we have to exercise. Regular exercise, physical activity will reduce the stress. Mindfulness practice also should be done. It is the best technique, such as deep breath and meditation. Now, third is time management. So you should manage your time. Set a realistic goal that suits to you. According to individual, you have to take care of your time management and take regular breaks. See, in Brahma Kumari, we have learned that after 1 hour, we should take 2 minutes break. And that 2 minutes break, you can breathe, or you can affirm, or you can see what you are feeling, how stress you have, and what kind of a problem you are facing out. So for that, you can take deep breath, or you can give affirmation to yourself, or you can have a self talk with yourself. Like this, while doing restless work, you should take 2 minutes break in between whatever you are doing. So it will give you new energy to face your problem or whatever you are doing. If you are stressed out, so you can come out from the stress, and you should energize more while doing these all activities. So I told you mindfulness, then time management is very, very important. Social support also, because see, if you will talk to your friend and you will tell her, him about your problem, it will be easy. Hmm? You can talk to your family also, or if you are not able to talk with these two, you can go to therapist or for emotional support. And one technique is also ki relaxation. Engage in activity that brings you joy and help you relax, such as reading. If you have interest of reading books, so you can read. You can listen music also. You can dance. You can paint. You can script a story. You can take warm bath. You can do small activities. Activity means we will do one small activity. You take your hand, right hand, to your heart, and keep the left hand on it, and take a long deep breath, then hold it.
Excuse me, Kusumam. Excuse me.
Yeah.
I think your slides are not moving. We are just seeing the first slide,
Ah,
introduction. Are
yeah.
you
So
explaining the first slide?
yeah, yeah. First
Okay,
slide.
okay, ma'am.
I told na
Okay,
ki I will explain three. There are 3 points. I will explain each and every one.
okay,
So we
ma'am.
are
Okay,
doing
please carry
activity.
on.
For that we are doing activity. So you can do this activity also. You can take your right hand and over that left hand, and then take deep breath, hold, and then release, and then say, I am love and light. I am love and light. Like this type of activity also you can do, so that you can improve yourself, your emotional and mental health also. Now, so these are these are, as I talked about, what stress is the natural response of challenges. I have taken this point and I have explained this point that what is the stress, what challenges we feel, uh, and a common source of stress also we talked about in this topic, and physical symptoms of stress also I told you that there are some symptoms, and I talked about that symptoms also, and then I told you how to manage your stress. Now second is chronic stress can have serious health implications. So I will talk on this topic. Chronic stress can have serious health implications. So chronic stress can have far-reaching and you can say devastating effects on both physical and mental health. Some potential health implication of chronic stress can be included, like a physical health implication. In this, what I will talk to you some points that these implication have chronic stress includes what physical, then in physical I will talk you, and mental health also, and I will talk other health implication also. So first of all I will let you know the physical health implication. In physical health implication I will take one point: hypertension. Chronic stress can lead a high blood pressure, increasing the risk of heart disease, stroke, and kidney disease. So this is was what physical health implication, what chronic stress. In chronic stress I am talking. And second is weakened immune system. So chronic stress can suppress the immune system, making you more vulnerable to illness like flu, common cold, or other infections. Now, third, I will take digestive issues. Chronic stress can cause stomach problems. So it is not so easy. If you are facing a stomach problem, don't take it very as it is. You should take care of why my stomach is aching, or what problem is going on, and you should go to the doctor because it is a digestive issue. So in this stomach problem such as IBS, acid reflux, or a stomach ulcer also. So, and fourth point I will talk about sleep disturbance. Sometimes what children face commonly, chronic stress can disrupt the sleep pattern. And this may problem, this should give you so many problems, like always having headache, not doing your work properly, your mood is always always you are not understanding what you are facing with, you are not able to explain. So all these is the problem of the sleep disturbance. Now fifth is obesity with weight gain. Chronic stress can increase the production of cholesterol, hormonal imbalance, fat in your body. So all this should be uh, taken care of, because these all are a chronic issue and you should not take it very easily. Now, mental health implication, in this I will talk to you anxiety and depression. It is also chronic stress. It is also the part of chronic stress and can contribute to the development of anxiety and depression. Now, mood swing. Chronic stress can cause whenever you are facing with irritation. It is the problem of chronic stress. mood swing, emotional instability. These all the problem of mood swing. Now, burnout, chronic stress can lead to emotional, mental, and physical problem also. Now, you can increase risk of mental health disorder in this chronic stress whenever if anybody is facing. So for that, what you have to do, you have to see the disorders, which type of disorder you are facing off. Now, other health implication is the skin problem, hair loss, then increased risk of chronic diseases. So these are the parts of chronic stress. And one of the primary area affected in the heart health, I will talk this topic also because chronic stress can have significant and it can be if it will be increased, so it will give impact on your heart health also. And it is a very major risk that if it will happen, then a heart attack and strokes problem also occur. Now, in this, blood pressure is the important part. So in blood pressure also, I will talk 2 points. Increased blood pressure. It is also chronic stress can cause blood pressure to rise. This I have talked about acute stress. This is short time I have explained. Chronic stress also I have explained. Emotional stress also I have explained, and physical stress also I have explained. Now, so I am talking about this. So increased blood pressure. In this, what happened? Ki chronic stress can cause blood pressure to rise, putting extra strain on the heart and blood vessel. Hypertension is also the major issue in this blood pressure problem. So for this, what you have to do, high blood pressure can lead to hypertension and a major risk factor of heart disease also. So we should take care of all these things also. If we are taking too much stress, so it will give so many bad effects to our body, to our heart, and to our soul also. Heart attack and stroke occurs when increased rise, when we are taking too much risk, then heart attack increase. And chronic stress can increase the risk of heart attack by raising blood pressure, increasing inflammation, and blood lipid profiles also be count in this. So what you have to do, you have to see that which kind of stress you are facing of. And if you are feeling your heart heavy, you should go to the doctor for the medication. Other heart related issues, we can talk heart failureness is one of the issue in that, and muscle weakness is also there. Ki if you will overthink a lot or you will take a stress a lot, then what will happen? The condition will come ki your muscles becomes very weak, and it will also lead heart failureness. And heart failureness occurs when your heart is unable to pump enough blood to meet the body's need. So managing stress of heart, how it is possible? Na question arises ki how we should manage this stress for heart health. So you should do regular exercise, engage in a physical activity that help reduce stress, such as walking, yoga, or swimming also you can do. And second is practice relaxation technique. In this, try stress reducing techniques like meditation, deep breathing, or progressive muscle relaxation is also there. So you can you can take that therapy also. Now get enough sleep. for enough sleep, what you have to aim, that you have to eat your meal before 7. If you are eating your meal before 7, it is before 6, but I am giving you 1 hour delay because everybody can't do the same process. But if you are taking your evening meal early, then you will sleep nicely. And your aim should be 7 to 8 hours to sleep per night to help your this stress hormones. Now, see social support. Connect with your friends, families, or therapists and manage your stress and emotion. Because, see, if you are not doing these all things, then you are not take caring of yourself, your body, and your heart also. So managing chronic stress is a crucial for managing heart health. And for this, what you have to do, you have to do daily practice to remove your stress. You have to take this all techniques also so that you can help yourself and you can help others also. Now, um, one thing is there ki, understanding the connection between stress and the heart health issue. So what you have to do for that, many practices are for that also. You have to increase heart rate and blood pressure and redirecting blood flow of muscles, and you should take the doctor's suggestion also. You know, the connection between stress and heart disease is hypertension. And then you have to see that what kind of stress you are facing out. And hypertension also, see it what it evaluate your blood pressure and can manage your blood vessels, increase the risk also. So you have to take care of all this. Then cardiac problem also, that leads changes in the heart structure and the function, making it less efficient and more susceptible of diseases. Inflammation is also there. Ki chronic stress can lead a chronic inflammation which can damage blood vessels and increase the risk also. And so many stress we are taking nowadays, and it is all the heart problem is arising nowadays too much because of stress only. So you have to take care which type of things, or what is the practices, or what is the unhealthy behaviors that you are taking every day, like poor diet, like physical inactivity, like smoking. These all things you have to see if you are doing, or if you are facing this problem, so you where you have to improve yourself. And practice stress reducing stress. As I told you, ki, more and more is required for this. Now I will make it easy because we are talking regularly for this. So what we will do, I will talk some quotes. I will give you some heart health quotes so that it can become very light also, and you should understand what I want to tell you. That one quote I like too much: a healthy heart is the key to a healthy life. So see, in your body part, heart is the major, what you call, heart is the major part, because without heart, body cannot function properly. So you have to take care of your body, and if you are taking care of body, so you have to take care of your heart. And for your heart, you emotion is very very important. If your emotions are proper, if you are taking your emotion very lightly, if you are with yourself, you are understanding what kind of problem you are facing, what emotions you are coming with, and how you are dealing that emotion, then it will be very easy to take care of your heart. And heart health is not just about the physical heart, but also about the emotional and spiritual heart also. So take care of your heart, and it will take care of you also. So, and some inspirational quote are also there that I resonate with. Believe you can, and you are halfway there. It does not matter how slowly you go, as long as you do not stop. So, how you will go? If you will take care of your emotions, if you will take care of your body, if you will love yourself, then only you are going to. And if you are stressed out, then your journey become very tough. So we should love ourselves, we should connect with the nature, we should connect with the people, we should take a proper diet, we should do what we like, and then we can come out of these all chest pain, and then sleeping difficulties, anxiety, and depression. All this will be lightened. Now, risk factors for stress-related heart issue. Here are some points that are, because see, I am taking, I am, as I told you, you have to take proper diet, you have to look after your lifestyle when you are waking up, after waking up, what you are doing, and then smoking and exercise, alcohol also consumption, if you are taking lack of social support, because nowadays we are so busy in our work and in our life, that we don't go out, we don't meet friends, and we don't connect with the social work, and these all are very very big issue for stress. Now, ways to manage stress. I told you, I have explained this, ki social support, counseling, फिर regular exercise is there, healthy diet is there, mindfulness and relaxation techniques are also I told you, educate, sleep, social support, and counseling is also required. If anybody is facing problem, he or she can go to the counselor also. If you are not able to tell your problem with your family or friends, then you can take the support of counselors, doctors, therapists, and all. So we have talked about this also. And conclusion part is chronic stress is a significant risk factor for heart disease, and proactive stress management can protect heart and health also. Small lifestyle changes can lead a long term benefit. So little bit of changes you have to make, and then you will beneficial with many, so many things, so many wonders, so many magic miracles in your life. Take care, yeah, take charge of stress for a healthier heart and life. So I will tell you one story. This is a story of one of my friend, Alina, and she was 35 years old, and she was a marketing executive. So she had always been driven to succeed. She worked long hours, often sacrificing her personal time and well-being for the sake of her career. One day, what happened, Elena woke up feeling exhausted and experiencing chest pain. She brushed it off as stress, but the pain is other. After a visit to her doctor, she was shocked because doctor has told that you have high blood pressure and you are in risk of heart disease. So she was much more upset, and she was advised to make life changes, reduce her risk. So she talked to me, she told me her problem, and I motivated her to control the stress and to get over and out of the stress. I talked her a lot, what is the problem, and what are the areas that affecting her lifestyle and her too, her emotion too, all this. And when I came to know, then I was surprised that she was not taking care of herself, and she wants to succeed a lot in the society, and she wants to show that I am so and so to the friends, family, and colleagues. So after all these things happens, I told her how to overcome. So I made her to do regular exercise. I told her to take healthy diet like vegetables, grains, lean protein sources, and healthy fat. And I told her to manage her time management also and weight also, because she was not taking any care of her weight. And stress also ki stress management also, I told her to do meditation, and I took care of her. And uh, she was not taking sleep also properly, so for that also I told her. And after all that, and doctor also was taking care of her. And by all these practices, uh, uh, she overcome of that problem. So see, it is very, very important, and I am always, whenever I am taking the topic, so I took topic with my areas only, or if I have seen in my school that children are facing children are facing problem, or parent is coming with a problem, or in society, in my area, if I am seeing anybody is facing problems, so I to take that topic so that it can resonate to any one of you also, or any of us, and we can improve also. Because see, we are knowing so too much knowledge, but we are not implementing in our lifestyle, and we are giving excuses to others. If mama says, why you are not taking care of, I understood that you have too much work, and but you should take care. So we are saying कि हाँ हाँ हाँ, फिर कौन काम करेगा, मैं ही तो करती हूँ. And this type of attitude is not good, because see, आप ही करते हो, आप ही सब कुछ करते हो, but you have to take care of yourself also, and that is your responsibility. So yeah, so if we will not take care, so many things will arise, and after that we will realize कि yeah, what areas I should improve, so that the problem should be a little. So see, I will give you some creative examples also, that if anybody is facing the problem na, so let the therapy go on. Whatever doctor's medication or a suggestion is going on, it should go on. But we should take care of this little things also. We should meditate. We should do yoga practice. We should take massage therapy also. We should in creative expressions, I will talk to you that art therapy is also the best to reduce your stress and to overcome of your emotions. Music therapy is also good. Writing therapy is also good. And social support, in social support, I will give you suggestion that talk to your friend and a family members, support groups also. If any group is there, join that and see that, because see, life is a experience only, and it is only one part of drama. If we are living 65 years, so God has given one role to us, and that role how we are playing we should know, because we are seeing the movie now, hero and heroine are playing the part. So we should also, we have also take care of that part, what part we have given, and nothing else. We think that मेरा बच्चा, मेरा husband, मेरा मम्मी पापा, मेरा ये, मेरा वो, मेरा, this is not good. This is not good. So we should only think that what we can easily do without stress, without anger, without anxiety. That is good for us. But if you are going beyond that, then you will face many problems. So these all the things are there. I will talk one, two more things also. Ki then we will go to the question. How to,
Ma'am, it's a wonderful session. Good awareness section regarding how we can balance stress, um, uh, and how to on the heart. Um, so heart is an important organ in our uh, body. Without that, we can't even survive. So it is an important thing how to balance the stress, and how to cope up with this, and how to control the hypertension and other heart inflammation, and the plagues and everything, with our to burn out the fire by doing the routinized exercise and everything. Good awareness session. The floor is for question. Those who are willing to share the feedback as well as to clarify certain things, please.
Good evening, ma'am.
good evening.
Very comprehensive and very clear cut pathway you have shown us, ma'am. If all of us follow what you have said, I think there will be less stress and less tension for us, and our body also will have the right balance of life. I think that is where we are having a problem. Work life balance and our personal life balance is actually getting tilted. We are
Yeah,
moving
ma'am.
so much towards work that we are forgetting
Hmm.
ourselves, or we are moving so much towards caring for others that we forget caring for our own self. So as a result, what
Yeah.
happens? We get totally burnt out. Like it is rightly said, the air hostess says, put the mask first on yourself and then help others. Here we do just
Hmm.
the ulta.
Yeah.
So we have to do that. Thank you, ma'am. Thank you for taking us through this. And your
Thank
voice was so soothing.
thank
Thank
you,
you.
ma'am. Thank you so much. Thank you
Lots to
so
learn
much.
from you.
Thank you, ma'am. Thank you very
Thank you,
much.
ma'am.
Others like to share something? I welcome you. Or otherwise, I will go ahead with Anita Ramachandran to give vote of thanks. Most of the feedback is very much nice, awesome, and excellent section. Um, very informative one. Good awareness section. Just like that, plenty of feedback is positive, very informative. Promise to share the PPT informative section.
Yeah, sure. I will share.
I request, with your permission, I request Anita Ramachandran for vote of thanks, ma'am.
Yeah, ma'am. Sure.
I request, ma'am, Anita ma'am to come.
Thank you, ma'am. Thank you.
Thank you, Meenakshi ma'am, for giving me an opportunity to propose a vote of thanks. That was a wonderful, very informative and meaningful session from you. And I think you gave us very, very important strategies of how we should actually deal with our stress and manage stress. And if we can avoid it, I think that will be the wonderful thing for us. And kindly accept our gratitude on behalf of the Department of Psychology, the American College of Madurai, in association with the Yellow Pond Counseling Center, Nolambur and Pallikkarne, Chennai, and the Deccan Positive Mental Health Practitioners Association, Telangana, Hyderabad. Dear friends, we will meet with yet another beautiful session tomorrow, same time. Stay tuned and keep learning and have a wonderful evening, all of you. Have a good time. Thank you so much, and thank you, ma'am.